I don't trust government. I don't trust public health. I don't trust my colleagues anymore. I certainly don't trust my college. And I don't trust our judiciary system. It's not about justice. I don't know where justice went. It's about little legal technicalities. And it's like, this is just wrong. I know right and wrong. You all should know right and wrong. This is wrong in this country.
Trey Humphrey here with Rebel News, bringing you a report you will not see from the state-backed media. That's right, Rebel News has been covering closely the National Citizens Inquiry that has been spreading across Canada. And as the BC Bureau Chief Reporter for Rebel News, I'm bringing you reports on their Greater Vancouver hearings that took place in Langley, BC. And in this report, you're going to hear from one of the people who testified, which is Dr. Greg Passey.
I believe laws have been broken. And so the way we address the perpetrators, the people that put together these narratives, is we need to go after them legally. I'm not sure I trust our judicial system 100%. A lot of the judges are political appointees. And a lot of them already have their belief system in place.
Standing with me right now is Dr. Greg Passey. Now, you just did an amazing testimony in there for the National Citizens Inquiry in the Greater Vancouver hearings here in Langley, BC. How are you feeling getting out of there?
It was great to finally have an opportunity to speak after 3 years of censorship by my government, public health, and my college.
Tell me about it. We know all about censorship here on Rebel News, and we've been following the NCI closely. There's lots of information, and I'll link a link to their hearings in the description box below. But I wanted to pull you aside because you are an expert when it comes to post-traumatic stress disorder. So why don't you tell us a little bit about that, and then I'll let everybody know where this interview is going.
Okay. So post-traumatic stress disorder is it's a diagnosis that typically happens after an individual has been exposed either to one or a number of psychologically traumatic events. So, for instance, a war zone, a bad car accident, crime victim, tsunami, those types of things. And it causes basically a whole set of brain dysfunction and symptoms as a result of that. And it can be actually quite crippling if it's not caught early and treated. So, yes.
And can you tell us a little bit about your expertise?
Well, the expertise is, again, with the PTSD, I'm both a national and international expert on PTSD. I've presented, in Europe, Japan, the States, etc. And I've treated people from basically all over the world, but particularly our armed forces personnel. I've treated people from World War I when they were still alive, right up to our most recent deployments and stuff. But I also take care of civilians.
Now, you mentioned wars, you mentioned tsunamis and things like that that could cause post-traumatic stress disorder. What about a pandemic or a pseudo-pandemic? What about what we've lived in since 2020?
Well, anytime you have a situation that generates a great deal of fear, it potentially can cause anxiety disorders, mood disorders, or post-traumatic stress disorder. And certainly the government and public health narrative generated a huge amount of fear in our population, adults as well as children and stuff. And so, there has been an upswing in anxiety and mood disorders, and I would expect to see some people coming forward with PTSD, for instance, our health workers having to deal with the dying and the fear of catching COVID, etc. So there's many aspects to this that we'll be seeing more of. It's still sort of early, and we're very limited in the number of professionals, specialists we have to be able to assess and treat this. So I think we're probably just starting to see the tip of an iceberg.
The belief systems are so ingrained, we can produce all of this evidence, all of this truth, and there's going to be a percentage of the population, probably including the perpetrators, that aren't going to buy it. It's like my patient says, I trust Bonnie Henry and the government. I don't trust your medical science. How do I break through that? I think it's partly, we need to look at the studies. I didn't talk about PTSD in kids. I mean, this has been very traumatic, right? You're ripped away from your friends. Your mom and dad are scared out of their skulls. I mean, there's a bunch of things going on there. So it's a matter of bringing forward the truth. But, there was a trial once upon a time, was the Nuremberg trial. And part of what came out of that is the necessity for informed consent, and that governments and other agencies are not allowed to experiment or use experimental drugs or treatment on us without our consent.
Now, did you find anything concerning about what, in my opinion, was a lack of mental health consideration when it came to what was being discussed on the proper steps that needed to be taken to dealing with COVID-19 through mandates and such?
Well, the mandates have been a problem. In regards to the mask mandates, the CDC was quite clear that they do not prevent respiratory diseases such as influenza and COVID.
I mean, basically, the virus, for the most part, spreads because it's airborne and not because it's sitting on a surface, although it can reside on a surface. I think the latest thing I saw for 2 days. But you're not going to get it from the surface unless you touch that, and then you start touching around your face, your mouth and stuff. So I think it was a very poor job in regards to how do you handle masks, how do you dispose masks. So, for people that use cloth masks, they should have been washed every day. Anyone using a N95 or surgical mask, they should have been disposed of every day. In theory, it's a biohazard, right? And I see them all around my neighborhood, and it's like, what are people doing? So it is a problem, but it's also a problem from pollution perspective, right? And we haven't talked at all about the microparticles that get deposited in your lungs when you're breathing through these things all day.
But the narrative from the government and public health was that this is a terrible disease, the high rates of death and stuff, and everyone should be wearing a mask. But for instance, for kids 19 and under, the risk of dying, there were 72 deaths in 3 years with COVID. The risk of
Under the age of
19. So you're averaging 24 deaths a year. The flu is anywhere from 9 to 13 deaths a year.
And that, just to interrupt, that's with COVID-19 that they died, not necessarily from.
Correct. So this is a problem. The medical system and public health did not do a really good job scrutinizing and differentiating between people with COVID versus people dying from COVID.
I mean, part of the problem is that the PCR test that we've used to attempt to diagnose and identify people that have the COVID virus was never developed nor meant to do diagnoses. And I don't think I need to get into all of that piece today. Part of the problem, though, was, individuals were, especially if they were admitted to hospital for anything, they were tested. And if they were positive, then they were identified as COVID patients. Now, a person that is a terminal cancer patient and is likely to die in the next month, testing them and saying, oh, they've got COVID, they've died from COVID, well, that's not appropriate. And I think we weren't strict enough when we were looking, and again, because it goes against the narrative. Ideally, the medical community would have been very, very strict in regards to diagnosing somebody with COVID versus, dying from COVID. They're two very, very different things.
The risk of dying is about 1 in about 80,000 plus kids. right? So very, very low risk. In fact, they're probably more likely to, well, they are more likely to die from an accident than from COVID. And yet they put the fear of God, or at least the fear of the pandemic, into kids. So they all had to mask up. And their natural immune systems are actually better than the adults. And they were never really at the risk that the narrative by the government, I call it political science, not medical science, the political science narrative, all these kids are at risk, was absolutely not correct. The statistics are very clear on that.
What happened to honor and integrity? Where did cowardice come from? Why does this narrative eliminate or attempt to eliminate the critical thinkers? You know, they used to talk about the thin blue line or the thin green line. It's like it's not a line anymore. It's little pieces of people trying to stand up. A lot of people are afraid. I got colleagues I can't believe. They're so afraid. They won't say a thing. They won't go. I can show them the evidence. Oh, well, that's, no. I don't know how to explain it. They're so brainwashed. The narrative at this point is one. And we are the only thing that stands between the narrative and complete disaster.
The government narrative, the authoritative narrative, has been established. And basically what they did is they picked on the group, the people that didn't want to get vaccinated for a variety of reasons. Trudeau used language like racist, misogynist, not following science. They take up space. Should we tolerate them?
Mais il y a aussi des gens qui sont farouchement opposés à la vaccination.
Qui sont extrémistes.
Qui croient pas dans la science, qui sont souvent misogynes, souvent racistes.
If you don't want to get vaccinated, that's your choice. But don't think you can get on a plane or a train beside vaccinated people.
Trying to bring people together is not always compatible with science, with respect for human rights, with the best way to move things forward. I mean, when Erin O'Toole talks about, oh yes, we need to unite people, we need to bring people together, he's talking about defending the rights of people who are anti-vax.
That's why we've been unequivocal. If you want to get on a plane or a train in the coming months, you're going to have to be fully vaccinated. So families with their kids don't have to worry that someone is going to put them in danger in the seat next to them or across the aisle. Those people are putting us all at risk.
The Liberals were elected with 32% of the population. And they're running this very strong narrative. And he's using language that vilifies, ostracizes, dehumanizes. They take up space. Should we really tolerate them? That's not too far from some of the speeches I heard Hitler. And now I'm going to get crap because I've compared my prime minister with Hitler. What I'm comparing is the process, and his words, although slightly different, are very similar.
I was in Rwanda. I've seen what governments can do. Rwanda, the Hutu government, said the Tutsis are subhuman. They don't deserve to live. 800,000 people killed, mainly by machete. And we have a prime minister that's using similar language against anyone that didn't get vaccinated. And he used a similar language against the Freedom Convoy, right? That's scary. Censorship. We're not allowed to offer an opposing view. We're not allowed to be critical thinkers. We have to buy his narrative, even when there's clear evidence that doesn't support it, actually proves otherwise. So, for instance, he says everyone should be vaccinated. Well, if you're vaccinated and the vaccine works, why would you be concerned if I'm not vaccinated? right? Doesn't make any sense unless the government and public health knew that the vaccines weren't effective. And if that's the case, then they want to make sure everyone gets vaccinated. And they were aiming for 100% vaccination, which means there would be nobody that wasn't vaccinated, which means we don't have a control group. So we can't determine whether or not your myocarditis, your brain disorder, your cancer, your miscarriage, whatever it happened, we can't determine whether or not that was due to the vaccine because we don't have a population to be able to compare to that weren't vaccinated.
Civilians need to come forward. That we need to document all of that. We need to sue. And part of the problem is the government has signed this immunity, no liability for the drug companies, right? Unless there's fraud. And then it's not there anymore. Did you know Pfizer they had to pay $2.6 billion in 2006 because they suppressed negative research outcomes and they fraudulently marketed their product? And they just this year, I think it's another $1.5 or $2 billion, and we trust this company?
These agreements require employees of the Government of Canada that access these documents to sign confidentiality agreements. And why is that? Why is there much more redactions, as my colleague said, in these documents than in other documents? It's because these documents were signed at the beginning of the pandemic, when everybody was desperate for vaccines, when companies were being told to rush vaccine production, do testing in an unprecedented way, in a way they normally don't do it. So these companies were exposed to way higher liability, putting their products on the market than they normally would because they didn't do the type of testing that normally takes these drugs years to come to market. They did it all in less than a year. So that's why these companies said, if I'm going to deliver you this product that I haven't tested in my normal way, I want to have different conditions.
I think they knew it wasn't effective, which is why they wanted 100. It wasn't about public safety at that point. You don't need 100% vaccination for public safety. If the vaccine's good, right, then you don't have to worry about the unvaccinated. But now we know it wasn't fully effective.
You're right. Without a control group or anybody monitoring the small amount that are still unvaccinated, how will we ever truly know what the long-term side effects are of this jab? And thanks for your words of wisdom and I think rightly placed concern when it comes to the leader of Canada's choice of words during COVID-19. I'm Drea Humphrey for Rebel News, and this is Dr. Passey. Thank you very much.
Thank you.
Did you know that just like the National Citizens Inquiry, Rebel News is also completely independent of government interests, and we rely on the people to be able to bring everybody the other side of the story. So if you appreciate the journalism that we bring you, you can go to rebelnews.com and donate what you can to keep our reports going strong. We appreciate your support.